Coronavirus and the rising metrics driven by the Delta variant. New tonight, a key member of our local medical community is weighing in on the growing hospitalizations and how this compares to past surges. KPRC 2 health reporter Haley Hernandez getting that insight from the leader of the Texas Medical Center. Haley?
That's right. So COVID-19 hospitalizations are about to match where they've been during previous peaks in the pandemic. And the Texas Medical Center president and CEO tells me we might even hit new records, even though half of eligible Houstonians are vaccinated.
Which was our highest.
Today, I sat down with the president and CEO of the Texas Medical Center, Bill McKeon. He says we are seeing the same acceleration of hospitalizations as we did during last summer's surge, but with a different demo.
What's so surprising is that right now we're seeing not the elderly coming into our hospitals. We're seeing young men and women in their 20s and 30s. As a matter of fact, the average age when we studied it recently, it is 20 years younger than it used to be.
The bigger internal crisis this time around isn't a feared shortage of ventilators and PPE, but a major staffing shortage.
They have beds, they have patients, and they don't have enough nurses to place on those beds. So the nursing shortage is really hitting us hard.
And even worse, he believes we haven't seen the peak yet and predicts we will see 300 plus patients hospitalized per day, mimicking some of the worst times of the pandemic before it begins to taper off again. But how is that possible if people in the community are vaccinated and have that protection against COVID?
But that other half is now dealing with a virus that's twice as infectious. It almost matches identically to where we were before when we didn't have a vaccine, because so many people are unwilling to get vaccinated.
Now, he says one of the worst parts for hospital leaders is that in the past, they were doing a lot more testing, and the testing would reveal a positivity rate that would indicate to them when hospitalizations were going to follow. McKeon says now they're pretty much flying blind because people aren't being tested as frequently. And now they don't know when those hospitalizations are going to follow, really, guys, until people end up in the waiting room. Reporting live in the Medical Center, I'm Haley Hernandez, KPRC 2 News.